Again.
Welcome, everyone. My name is Julie Terode. I'm on the Executive Council of AORTIC, the African Organisation for Research and Training in Cancer. I'm joined by Abigail Simon-Hart, a volunteer steering committee member of the Voice Project, a partnership between Global Focus on Cancer and AORTIC. Why don't you introduce yourself, Abigail?
Good morning, everybody. So, as Julie rightly said, I'm Abigail Simon-Hart. I'm a breast cancer survivor. I'm also an advocate, and I'm the co-founder of the Bricom Foundation, which is a cancer charity in Nigeria that works with cancer patients and their families.
Thanks for joining me on this webinar, Abigail. This tutorial is really in support of webinar 2 of a series of webinars in the Voice Project, which is introducing policy-facing advocacy to advocates across Africa. So webinar 2 is focusing on policy mapping. So let me ask you straight off the bat, Abigail, what is it like for you when you try and find country policy documents in Nigeria?
I think one of the challenges is first of all, finding which is the most recent, and then getting everything in one place because they tend to be scattered. So
Yeah,
it's really about where can you really find everything in one place to make it easier to compare things. I think that's always a challenge.
absolutely. And definitely knowing whether it's current or not is highly
Exactly.
frustrating. I also find it very difficult to navigate government websites. If you don't know what the document's called, it's very difficult to find it sometimes. So this video is introducing the International Cancer Control Partnership Portal, which is the first place to be able to look at national documents and resources, and particularly national cancer control plans. So it's a good place to start when you're thinking about what level of policies does your country have for cancer prevention and control. So let's go to the website, and I can just type in here www.iccp-portal.org, and we should go straight to the website, which you can see here, the International Cancer Control Partnership. So very easy, I think, to decide where to go next would be to click on the national plans. So Abigail, what do you see here? Is quite a lot going on this first
Yeah.
site.
So I mean, I'm assuming, if you click on the country, does anything happen?
Yeah, so look, you can see Africa here in the middle, and you can hover over the country and just get a very quick view of what's going on. So you can see here in Algeria, their most recent plan was reviewed in 2023.
Okay.
Go down to South Africa, also 2023. And you can see the grading here, these different shades of green. And this links to the index here, which was the review conducted by the partnership. Which is numbered out a grade out of 100. So you can see when we go to your country, Nigeria, you're at a 47 out of 800. So doing quite well as far as the coverage of topics in your cancer plan. So let's have a look and have a quick find, see what we can find for Nigeria. So firstly, you would put in your country, and then you can click on the blue tab, and we zoom in on Nigeria. And this here are the scores for that make up your 47 out of 100. But let's
Okay.
first look at the resources. So we're particularly interested in cancer plans. And already you can see here that your country has 4 plans. So it already then addresses that first issue you were talking about. How
Yep.
many plans are there? Which one is current? So let's have a look here. The first plan ran from 2008 to 2013. Then went through to 2022. And your most current plan runs through to 2027. So
Yeah.
already you can look at comparing those and see how they've evolved over time.
Fantastic.
Interestingly,
But
also one for Kebbi State. So it's actually a state level plan. So if you're not in Kebbi, maybe you can look at that and say, well, why don't we do a state level plan as Kebbi has done? And that runs through to 2023. So perhaps they're in the process of updating that. So if you are in Kebbi, it might be something you would like to get involved in.
I guess also if there is a plan in existence that that ICCP is not aware of, it can also be sent to ICCP to upload so that it becomes like a central repository for all these plans, isn't it?
Absolutely. So this is a 10 years old partnership now. So over the years, we've collected plans and we do reach out to countries and encourage them to share their plans as well. And there are some technical assistance pieces that the partnership does. So again, if a country is working on technical assistance, they then may share those resources once they're finalized.
Okay,
So
fantastic. So I assume at the end of this, you let us know how people can get involved.
yeah, let's have a look further at some of the policy facing materials. So along with the cancer plans, you can also see that the NCD plan, the non-communicable disease plan, is there.
Mhm.
That's useful, particularly on the issues of common risk factors with
Yeah.
cancer. And these might be more detailed here than in the cancer plan, for example. So here again, Nigeria's done quite well. We have a plan from 2013 and now a current plan running from 19 to 2025. So worth having a look there to see what commitments and activities planned. If you scroll down further in the resources, you can also see the country profiles for Nigeria. Let's have a look at those. And these are documents generated by WHO through a survey to all countries. So that's
Okay.
quite useful because you can compare country to country. The same questions are answered by Nigeria as by Ghana or Tanzania and Kenya, so you can compare. And this
Okay.
was done firstly in 2014, and then again in 2020. So already that's an interesting place to look for the progression over those 6 years. And we're looking forward to actually a new set of country profiles in 2025 alongside the global status report on cancer. So we'll actually have some more information coming in very soon.
Okay, fantastic. And there should be quite a big difference because there has been a lot of focus on cancer in Nigeria in recent times. So that would be an interesting document. Yeah.
Absolutely. And I think that's also good because sometimes as an advocate, you're always saying what's not happening. It's actually sometimes good to acknowledge what has happened. Yeah, the progress
Exactly.
is being made. It's a very good point. And then for us as advocates, there's two interesting documents in addition here. The cervical cancer profile is very much in line with the global strategy towards elimination of cervical cancer. So these were done in 2021, and there will be an update again in 2025, probably around September time. So again, this is useful to look at very specifically for cervical cancer elimination, and it has elements on each of the three pillars, which we'll talk about in the webinars as well.
Fantastic.
And then there's also a survivorship profile, which might be an interesting one to look at if you're particularly working with patients as advocates. And this is looking at what type of survivorship efforts are mentioned in the cancer plan at the moment. And it tends to be an underrepresented area in most cancer plans. But you can see that at least from the healthcare professional capacity, there is some efforts around survivorship. But in fact, mostly still a lot to be done in Nigeria. So that might be an area of interest for some advocates.
That's also good because it also shows you, it actually guides you in the areas where there's lapses. So it's almost like it's like you
Absolutely.
can prioritize what's important to you from what you're seeing in that. So that's actually an excellent tool. Yeah.
So if we switch to domains rather than resources, we also come to this scoring that we talked about before. And what I like is this new addition, the spider chart. And this does exactly what we've just been discussing, but for the cancer plan itself. So
Yeah.
you can see the higher the score, the wider it comes out on the web, the stronger the areas are in your cancer plan. So you can see that the Nigeria plan is actually doing well on financing, research, health workforce. These are all areas that are actually quite weak on some plans. Doing well on palliative care and supportive care. But you can see some areas are completely not addressed, such as emergency preparedness and health equity, which maybe are newer topics for cancer.
Is this web going to be up, this particular document, will it be automatically updated when the new information comes in? Because I would imagine that health workforce, because of the brain drain so there may be some downside going down in terms of this spider chart if there's new information put in, because we're all aware that there's a huge brain drain now in terms of generally in medicine, talk less of in cancer space.
Well, especially with the your global downturn in aid, international aid, you could imagine that many health workers might be thinking about emigrating and using their skills elsewhere. So it is a big area. Now, these scores all come from the formal review that the partnership did. So it
Okay.
would require another review, which we might do maybe in another 5 years' time. But the plans aren't updated that much. They're
Yeah.
generally run for a 5 or a 10-year period. So that this is really about the strength of the plan. It doesn't tell you how much
Okay. The
being
impacts. Yeah.
implemented.
Yeah. The
So
actual.
again,
Yeah.
that's
Yeah.
an area for advocacy where you say, well, you've got some great ideas in the
Mhm.
plan, but they're not actually happening and we're losing health workers. So that might be an opportunity to discuss. So each plan that has been reviewed will have one of these spider charts in it, which will mirror these scores. So it's a great place to just get an overview of what the strengths and weaknesses of the plan are, and also to see if you've got a specific interest. Like I know you work very much in palliative care, Abigail. You can see how does palliative care weigh up compared to other areas such as early diagnosis or prevention. Okay. So you can see even in these tabs of the domains and the resources, there's a lot of understanding that you can bring together. You can find a lot of documents. But you talked about what about other resources? So
Yeah.
when we look at, for example, our issue of raising the profile and doing advocacy on women's cancers, you could question, are there some countries in Africa that have good breast cancer strategies that might be useful for you to work upon? So
Yeah.
here you can just put it in. So you can see here there's a menu, so you can just click on there if you would
Yeah.
like to have a look. But you can also put in here the search times term. So if we just put breast cancer strategy Kenya, for example, let's see if Kenya has one. Not seeing where the resource is popping up. So it looks like breast cancer strategy is not available in Kenya, which is unusual. Here we are, but there is one for Zambia. So that's an interesting place to have a look and say, well, what's Zambia got in its plan? I think it was done in 2022, you can see, so it's quite current. So it's an interesting one to look at. And you could look at a particular country and see what resources they have, or search for a particular type of resource. So as we're moving forward in women's cancers, we'll be really looking for national strategies on breast cancer, national strategies on cervical cancer, and some countries might actually look to combining them, which might be an interesting approach as well. So it's a good place to start. Get your head around what does my country have? What are the best performers in the peer countries that my country might consider comparing with?
Yeah.
And that's often a good advocacy trick as well, to say, well, look, this is what Zambia is doing. Aren't we working on a breast cancer strategy?
Yeah. Just
Okay.
like in Nigeria, we could be looking at what is Ghana doing, because Ghana is literally our next door neighbor. So yeah.
Yeah, so let's have a look what Ghana has, which might be useful for you. You can just type in Ghana and you can see there's some work on cost effectiveness, a couple of articles on their policy and programmatic response to NCDs, the cancer plans and the profiles, but
It's
not
quite a bit, yeah.
actually a breast or cervical cancer strategy at the moment. Right, so that's an interesting area. If you'd like to know more about the reviews, you can look at the publications themselves, the two review articles, 5 years apart, and you can see, some of the activities. So we do technical assistance, for example. So if you are working with your country, you might want to think about suggesting they get involved or request technical assistance. And we'd be more than happy to help guide you in how to do that in more detail.
Fantastic.
So I think we've done quite a good start on policy mapping. Any last tips to advocates when they're thinking about work, starting out on understanding how to get involved in policy?
I think the most important thing is knowledge is power. You have to know what you're advocating for. You need to know what exists and then see whether it aligns with what you want and reach for low hanging fruit. It's all about reaching for, because when you reach for the things that are important but easier to do, then you get encouraged and you can make impact. Because if you look for the things that are really complicated, you're going to get really frustrated. So it is read, because it's really about knowledge, and knowledge does give you power, and it gives you a platform, and it makes you look, it gives you strength when you know, when people know what you're you know what
Yep.
you're talking about. And that's really important to be at par with the people that you're talking to in terms of knowledge, and that really gives you the strength and the voice, knowing fully well that you're armed. You can quote where you found things, you can quote existing documents. It's not something you pick from the sky, it's not a wish list. Policies have been done and you would like them to, you're not asking for anything special, you're just saying, look, can we just have what you say you're going to give us in the policy? So I think, yeah, that's what I would say.
No, it's a great place to start, and also start to build relationships, which you will need to do if you're going to be engaging with policymakers.
Exactly.
As you say, that small first step is a good way to show you're a good player, a good friend, wanting to move the agenda forward. So thank you very much, Abigail, for helping
You're
us
welcome.
with this
Thank you so
tutorial.
much. And
And
everybody, make sure that you come to the conference and learn. And we look forward to working with you to make a better Africa for women's cancers.
thanks very much. Goodbye, everyone.
Bye. So I think it was fine. Hopefully recorded this time.
I'm just wondering where to stop the recording. That's up here.